Let's talk about herpes. There are two types of herpes that we care about, herpes type 1 and herpes type 2. Herpes type 1 is also known as cold sores. About 70% of the US has them. It's not a big deal. Now, herpes type 2 is sexually transmitted, and it is an infection that we can't cure again. And that is a nuisance, not serious. It usually doesn't harm you. It just causes these sores. In my experience, people have a lot of emotions and a lot of stigma around it, sometimes worse than getting a diagnosis of HIV. It seems like for some reason in our culture, having herpes is the worst infection to get. However, from a doctor's perspective, it does not kill you. It does not harm you in any major way. It's just these sores coming back and forth at its will when you're stressed. What are the symptoms of herpes? Usually they're a group of sores. Usually they start off like blisters with fluid underneath. And what happens is that then those open up and those become raw sores. Herpes is usually painful. Sometimes it's itchy. Once those open sores are there, then they'll scab over and then they'll heal up. The virus, after those symptoms, actually goes back and hides along a nerve and sleeps. And then when you're stressed or something else happened, it gets activated again and usually goes back to the exact same spot and causes those exact same symptoms. That's sort of that nuisance. It's there. It comes back whenever it wants, whenever you're stressed out in life. And that's the cold sore or the genital sores, period. So what we can do with medications is suppress it. So you can take medicines that helps it stay hidden and stay asleep. But if you don't take those medicines, then it comes back out again. The herpes blood test is problematic because it can have a false positive, which means that it can tell you you're positive for herpes when you're really not. So if it's a low level positivity, that doesn't necessarily absolutely mean that you are positive for herpes. And therefore, you walk out of the office thinking you're positive when you're really not. So the other way you can test besides the blood test, a swab test. So if you have the sores, if the sores are active, and if they're relatively fresh, they have to be within the first 2 weeks of being presented. You take a swab of the sores and then you can pick up the virus, and that's what we test for, and we can find the virus. So how do you protect yourself? Condoms actually are the best answer, although condoms only protect the area of the skin that it covers. If those sores are outside of the area of what the condom covers, you still can be exposed and still can get it.